Good afternoon. Good afternoon, guys. I've got discussion A for you. Now we are discussing um, small changes, big impact, advancing longevity. Okay. I've made a little speech for this one, so please enjoy. Chair, members of the committee, thank you for the opportunity to speak today. My name is Felicia, and I serve as a geriatric specialist. In Northwest Pennsylvania. Every week, I care for older adults who believe they've missed their chance to improve their health. They tell me they should have started earlier, that their bodies are too far gone, that the window for change has closed. I'm here today to share evidence that directly challenges that belief, and to outline policy actions that can help Pennsylvanians live longer, healthier lives. The evidence, small changes drive measurable longevity gains. In new research from international cohorts and major public health institutions show that longevity is not driven by extreme interventions. It is driven by small, sustainable changes in daily habits, changes that are accessible to nearly every Pennsylvanian. Studies demonstrate that 5 minutes of moderate activity per day can reduce premature mortality by 6 to 10%. 30 fewer minutes of sedentary time improves cardiovascular and metabolic markers. 5 additional minutes of sleep reduces inflammation and stabilizes metabolic pathways. Half of serving of vegetables per day adds measurable years of healthy life. Just a second, guys. These findings are consistent across age groups, including adults in their 60s, 70s, and beyond. The body continues to respond to small improvements even late in life. Why this matters for Pennsylvania. Pennsylvania is aging faster than the national average. Our long-term care system is strained. Our rural counties face rising chronic disease burdens, and many older adults live on fixed incomes that limit access to healthy foods and safe environments. for physical activity. Longevity is not simply a personal benefit, it is a public health and economic imperative. Small evidence-based changes can reduce hospitalizations, lower long-term care utilization, improve workforce participation among older adults, strengthen community well-being, reduce Medicaid, Medicare spending over time. These are high-value, low-cost interventions with broad population impact. Policy recommendations. To translate this science into statewide benefits, I urge the committee to consider the following actions. Expand community movement infrastructure, support walkable neighborhoods, safe sidewalks, and micro mobility spaces. Even 5 minutes a day of daily movement requires safe, accessible environments. Explore community movement policies, fund low cost nutrition programs, increase access to fresh produce through senior center meal programs, mobile markets, and SNAP matching incentives. Review nutrition policy options, support sleep health education, integrate sleep health messaging into public health campaigns and primary care visits. Small improvements in sleep yield outsized benefits. Develop sleep health initiatives. Reduce sedentary time in workplaces and senior centers. Encourage movement breaks, standing options, and brief activity prompts in community settings. Excess sedentary time reduction strategies. Invest in community health workers and aging navigators. These professionals help older adults adopt small, sustainable changes and navigate barriers such as transportation. Food access and chronic disease management. Explore CHW expansion models. The human reality behind the data. People don't ask. It's too late because they want statistics. They ask because they are afraid of decline, regret, and what they can't undo. But the science offers hopeful message. The body does not hold grudges. It responds to what we do next. 5 minutes of movement, 2 minutes of brisk activity, half a serving of vegetables, a few more minutes of sleep. These are small things. They are the beginning of a different future, one that policy can help make possible for every Pennsylvanian. Thank you for your attention, for your commitment to the health of our communities. Okay, guys, here's the second part of A for you. And again, it deals with small changes for longevity. Here we go. Here's the title: Small Changes, Big Impact, Longevity Strategy for Pennsylvania. Pennsylvania is aging faster than the national average, with rural counties facing the steepest challenges: higher chronic disease burdens, limited transportation, shrinking workforces, and constrained access to nutritious food and preventative care. New research shows that small, sustainable daily habits, not extreme interventions, produce measurable gains in longevity and health span. These findings offer a low cost, high impact opportunity for statewide policy action. Large international studies demonstrate that the modest daily changes significantly reduce early mortality, improve quality of life. 5 minutes of moderate activity reduces premature mortality by 6 to 10%. 30 fewer minutes of sedentary time improves cardiovascular and metabolic health. 5 additional minutes of sleep reduces inflammation and stabilizes metabolic pathways. Half a serving of vegetables adds measurable years of healthy life. These benefits apply across age groups, including adults in their 60s, 70s, 80s, and are especially relevant for rural communities where access to gyms, specialty care, and fresh food is limited. Why it matters for Pennsylvania. Longevity is not only a personal benefit, it is a public health and economic imperative. Small evidence-based changes can reduce hospitalizations and emergency department use, delay nursing home placement, lower Medicaid, Medicare spending, improve workforce participation among older adults. Strengthen rural communities' stability and resilience. These interventions are low cost, scalable, and accessible, making them ideal for statewide adoption. Policy recommendations: expand rural movement infrastructure, invest in sidewalks, safe shoulders, walking loops, and micro movement spaces near senior centers, libraries, and parks. Explore rural movement policies. Strengthen nutrition access for older adults. Support mobile markets, produce trucks, senior center meal expansions, and SNAP matching programs to reach food deserts. Review senior nutrition policy options. Integrate sleep, health, and health education into public health. Partner with primary care and EMS, libraries, and faith communities to deliver simple sleep health interventions. Develop sleep health initiatives. Reduce sedentary time in workplaces and community hubs. Encourage movement breaks, standing options, and brief activity prompts in senior centers, county offices, and rural workplaces. Access sedentary time reduction strategies. Expand community health workers, CHWs in aging navigation and navigators. Deploy CHWs to help older adults adopt small changes, navigate transportation barriers, and manage chronic conditions. Improve rural broadband for telehealth and health education. Reliable broadband enables sleep coaching, nutrition guidance, chronic disease management, and remote monitoring. Small changes, 5 minutes of movement, a few minutes of sleep, half serving of vegetables, produce measurable gains in longevity and lifespan. These interventions are simple, affordable, and accessible, making them ideal for rural and statewide implementation. Pennsylvania can lead the nation by adopting a longevity strategy. Okay, guys. I'll be on later for the rest of the shows this evening. Until then, Gator Wellness. Take care, folks.